Thanks, Deb, and welcome everyone. I think we should all wear red a lot more often. If you could see what I'm seeing, we look great. So I've been working in cardiac rehab now for 20 years, and I welcome any opportunity to tell women about heart disease. We do what we call secondary prevention in cardiac rehab. Anybody who comes to me professionally already has a problem with their heart. What I really like to do is get to you before that happens, because it's not fun. But I thought since we're going to end the night with laughter that we might start off with just a little bit of fun too. So I have a little video to show you. We'll start with that. Can we dim those lights? I think we might need to. At least the ones on the screen. You may have seen this on the computer. It was going viral for a little while.
It started out like a totally normal day. Mom! Okay, move objection deadline to the third line after survey. Oh, honey, for when you always use the verb start. What are you doing down there? Did you finish your breakfast? Ow. Whew. Don't hit your brother. I mean, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Where are your shoes? Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh, my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, here. Nobody move. I'm getting a dustpan.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. Totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart, and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
Okay, Deb. So every time I watch that, it reminds me a lot of my life as it used to be. It's not anymore. But it's so typical, isn't it, for, let me see. Deb, do you know how to get this so top doesn't show? Well, just so it takes up the whole screen. Sorry. Thank you. Thanks. So It makes light of it, but it's so typical of women's responses, isn't it? Taking care of everybody else, that's what we do. And putting things off and asking for an extra 10 minutes so everything can look good. And I see this happen. So I thought it would just illustrate a little bit. And like in cardiac rehab, we can laugh and have a good time, but it's really serious business. So the title of this talk is Tell a Friend About Heart Disease. So if I can speak to each of you, there's about 50 or 60 women in the room. If you can each tell one or two friends, we will have spread the word. Because back in the 90s, only 27% of people, I think, were coming up to the slide. Women just didn't know that heart disease was a problem for them. They worried about their husbands, they worried about their fathers, but they did not worry about themselves. But as you can see, if you get a chance to look at my poster for cardiac rehab, women have heart attacks, and they have them sometimes at very young ages. The young woman over there, Kristen, was 35 years old and had had a baby 3 months before. And she experienced some chest pain when she was out walking the baby, but she's 35 years old. She wasn't overweight, she didn't smoke, she exercised, you know, so she just figured, well, the baby's heavy. She's got a nice healthy baby, big and heavy. Happened one more time in the middle of the night, and the only reason they called 911, because still she's 35, but now at this point they thought they should check it out, but they called 911 because they have the baby, and the husband said, go ahead, you go in the ambulance and I'll bring the baby. Well, she cardiac arrested 3 times in the ambulance, so her husband got to the ER with this brand new baby and a wife that they didn't even know if she was going to make it. So thank God she was in the ambulance, and she did do very, very well. But you know, it can happen to any of you, and we would just like to help let you know that it's an important risk factor for you. We want to see how much of a risk you are at having heart disease, and then we'll talk some about prevention. And I'll make sure to leave plenty of time for questions afterwards. So it is the #1 cause of death in women, and I know we hear a lot about breast cancer, but it's heart disease is the #1 cause of death in women, and stroke is the #3 cause of death. So it's very important to know the symptoms of heart attack and stroke and getting help promptly. And then again, if we can, the best thing to do is prevent it. So people are usually shocked by this. And I know that women get breast cancer, but women die from heart disease. 1 in 4 women die from heart disease, and 1 in 30 women will die of breast cancer. These are grim statistics. I always hate putting these out there. That's why I thought we'd start with a funny little video, because there's nothing funny about those numbers. Very serious business. But like I said, in '97, only 30%, less than 1 out of 3 women knew that heart disease was the leading cause of death. And now we're up to 57%, but we still have a ways to go. So unfortunately, some more grim statistics before we get into it, but women are more likely to die in the first year. 1 out of 4 men will die in the first year after a heart attack, 1 out of 3 women. And they're not exactly sure why. It could be that women don't present themselves for care as quickly as men do. They might have less typical signs. They really don't know. They are studying it, and the government requires that all heart disease, that women be studied as well. It used to be, when I started cardiac rehab just a short 20 years ago, that only men were in as research subjects. Because women, you know, they have all those hormones and funny things with periods, and it just messes up statistics. So they didn't study women, they just figured we were just sort of like little men. Turns out we're not. Big surprise, huh? All right. So we're going to talk about knowing your numbers, and the ones that we're going to concentrate on tonight are cholesterol, blood pressure, and blood sugar, because those are important risk factors for heart disease. All right. So I have a handout that I hope you'll all get, which is a really nice summary of most of this, and it talks about what level risk you are for heart disease, whether you're low, moderate, or high. And as well as heart attacks, the same things can cause a stroke. So we want to make sure that you know what your risk is. And I just have dealt with women and myself long enough to know that you're all thinking, I got to tell my sister about this, or I got to tell my neighbor. But for tonight, I would like you to concentrate on you and what your risk is. We're also going to talk about risk factors. Risk factors are things that make it more likely for you to have a heart attack. Almost everybody can tell me about this person who smoked until they were 100, never exercised, and ate bacon and cheese for their whole lives, all right? But for every one of those people, I can show you many who were cut down by heart disease at a much younger age than they needed to be. But I can't tell you if you smoke, you will have a heart attack, or if you have high cholesterol, you will. I can tell you it's much more likely. So the risk factors, that's what we call risk factors. What puts you more at risk? These are the things you can change. The physical activity, how much you move. Life stress. We can't control the stress that's going to come our way, can we? It would be lovely. But we can control and change how we respond and react to it. High blood pressure, obesity, diabetes, high cholesterol and triglycerides, smoking, and an unhealthy diet. And when I say unhealthy diet, we're talking about high in saturated fat, trans fat, and calories, and low in fresh fruit, veggies, whole grains, and fish. And I won't talk too much about diet because Jessica's going to take care of that. There are things that put you more at risk too, is your age, your gender, and your family history, but we're getting older and we can't change who our relatives are, so we're not going to concentrate on what we can't change. So those who are at high risk for heart disease, if you have already been diagnosed with a heart attack or a coronary artery disease, you're absolutely at high risk. You know that. If you get angina or have other problems with your circulation. Diabetes is a very important risk factor. People who have been diagnosed with diabetes should be treated as if they've already had a heart attack. It's that serious a risk factor. And chronic kidney disease as well. Those who are at moderate risk of heart disease have one or more of the following risk factors. So you can see the high cholesterol, diabetes shows up again, smoking, high blood pressure, a family history of heart disease or stroke at a young age. If your father or mother had a heart attack and died at 80 years old, that's not a risk factor. I had a sister who had a heart attack at 48. So I definitely have that risk factor for me. We're going to talk more about the metabolic syndrome. It's a series of symptoms, and I can tell you more about that later. And if you've ever had an exercise stress test and could only go 2 or 3 minutes, that also puts you at a moderate risk. People who are at low risk or optimal risk have no major risk factors, healthy diet, daily exercise. It's a very small percentage of women who have that. I think it was around 9% of people who come to see the doctor have this kind of profile. Is there anybody here who doesn't have any risk factors? No, including me. So the first risk factor we'll talk about is high blood pressure. It's very common, even if your blood pressure has been normal all your life, all of a sudden you go to the doctor, maybe post-menopause, or things just start changing, and all of a sudden you've got high blood pressure, and it doesn't have symptoms. I take blood pressures all day long, and people will come in and sit down and say, oh, it's going to be so high today, it's terrible, and they're 120/70, they're great. And other people who think everything's just fine, and I take a blood pressure and it's 180/100. So you can't tell by how you feel. It has to be measured. And that's why they call it the silent killer. It doesn't have symptoms. And unfortunately, some of the medications for blood pressure, they do have symptoms. They have side effects that people don't like. And because they have a disease or something like high blood pressure that doesn't have symptoms, they stop taking the medication. So it can be a deadly choice. These are the numbers that you want. Absolutely ideal, 120/80 or less. Pre-hypertension, now before, we used to say high blood pressure was 140/90 or more. And with all the studies that they've done, they've decided that there's a pre-hypertension in between that 120 and 140, and in between the 80 and 90 and 99 is 90. Your risk starts going up. It starts making changes in your heart. Your heart has to pump harder because you've got more pressure going against it, and your heart starts to get a little larger, and just small things start happening that are best not to have happen. So we really want to look for the ideal if it's possible. So you can see how great it is to treat this, because you're going to reduce your risk of stroke by 40%, heart attack by 25, and heart failure by 50%. Heart failure means that your heart doesn't just stop, but it gets big and boggy. Instead of having a nice strong pump, you got kind of this blown up ball that just doesn't work very well and doesn't pump the heart around very well, the blood around very well. And when that happens, it starts to really give you symptoms. So what can you do? If you can take a 30-minute walk a day, and they've done studies now. I know sometimes you think, how are you going to fit another 30 minutes into a busy day? But it's actually just as good if you break it up into 10-minute segments. So it has to be at least 10 minutes, but I work full-time, busy life, okay? I can go out if I know I'm going to have a really busy day and start my car up to warm it up and take a 10-minute walk, okay? Then at lunchtime, 10-minute walk. If it's lousy weather, I can walk all around the hospital. And then when I get home, just before I go in the house or right after dinner, another 10-minute walk. So you've found 3 10-minute segments and you got your 30-minute walk in. I'm a big proponent at looking at solutions instead of just the problems. You want to avoid being overweight, and I know that every woman in America knows this, all right? None of us want to be overweight, but we think, what am I going to do? It's just too much work and too much trouble. But I wanted to bring you something to show you. People tell me, I only lost 1 pound. That's a pound. Put a few of those around you. It makes a difference. And this is 5 pounds. Wow. Okay, so really, it's incredible. And, you know, so even if you set your goals for doable things, maybe you say, okay, ideally I should be losing 40 or 50 pounds. Start with 1 or 5, okay? It really makes a difference. Lower the salt in your diet, and most of the salt does not come from the salt shaker. It comes from the prepared packaged foods that you get, and also the bread and the pasta. Look at the label on your bread, and you'd be very surprised at how much you're getting with 1 slice. Heart-healthy diet, lots of fruits and veggies. We're always telling you what not to do. If you take nothing else home from this talk, eat more fruits and vegetables. And take the right medications. You really need to take your medications, and don't stop taking them. Tell the doctor, work with the doctor. Many people need more than 1 medication to really get it under control. So high cholesterol, another big risk factor. Your total cholesterol, we'd like it to be under 200. These are the numbers again. The bad cholesterol, LDL, and people can always get LDL and HDL mixed up. So what I tell you is the LDL is the lousy cholesterol. It's the one that clogs up your arteries, and you want it low. So this says under 100, and that's for people who have not been diagnosed with heart disease. Most of you, if you have diabetes or have heart disease diagnosis already, your doctor's probably going to want it to be 70 or less. Good cholesterol, H, high, it's heavenly. You want it as high as you can get it, hopefully greater than 50. And the triglycerides, another type of fat in your diet, less than 150. This will often, you'll see, elevated with diabetes. So the main thing that they're looking at these days is the LDL, the bad cholesterol. So if your doctor tells you, well, your cholesterol is 230, or, you know, people only know the main number, ask them what your LDL is. You really want to know all the numbers. Again, the healthy behaviors are important, and the same ones are going to help you to take care of your cholesterol. Of course, we're dealing with women, so you're pregnant or nursing, shouldn't be taking cholesterol medications, but otherwise it's an important discussion to have with your doctor if you've made the changes that you're going to make or can make and your cholesterol is still high. Diabetes, just so important, and it has increased 50% in the last 10 years. And it's amazing because it's now we're seeing young children get diagnosed with type 2 diabetes, which used to be a disease of middle-aged, overweight people. Now we're seeing 8-year-olds, 10-year-olds with the obesity problem. They're being put on medications for diabetes that have never been tested with children, and they're probably going to be having their heart attacks when they're 20 and 30 years old. So it's really something we need to look at. And a woman has a lot of control about how the family eats. You can see 5 times the risk of heart disease of a woman without diabetes, so it's really important. And they get it at a younger age. If you have diabetes, it makes it absolutely critically important to take care of all your risk factors. So your fasting blood sugar level less than 100, and what we have now is another new number called pre-diabetes. And there's actually some good news in this pre-diabetes, okay? With it's 100 to 125, they've done a study that shows that you can actually prevent or delay the onset. So you've got a major disease that you can actually escape from, okay? You can do that by walking moderately, again, 30 minutes, 5 times a week, losing some weight as little as 10 pounds in the study, and changing your diet, losing weight, changing your diet, and walking. So you can actually avoid diabetes, but it's a window of opportunity. And if you don't take advantage of it when you're in the pre-diabetes stage, you will develop diabetes, and then you're just going to have to deal with that. So small steps make a big difference. Again, don't forget that visual of that 1 pound, 5 pounds. So smoking is the #1 preventable risk. You know how we all felt at 911 when those planes crashed in. The smoking deaths in this country are as if 2 jumbo jetliners crashed every single day. It's really incredible. It's a terrible addiction. I was heavily addicted. I quit many years ago. It's the best thing I could have done for my health. But it's one of the hardest things, even all these years afterwards, it's one of the hardest things I ever did. So don't be ashamed. I know people smoke. It's so not cool anymore. When I quit smoking, everyone was smoking. There were ashtrays everywhere. So people have told me they hide in the garage. They feel like thieves when they're smoking a cigarette. But just admit it, get the help, keep trying, do whatever you need to do. Again, the obesity, we said it increases your risk of high blood pressure, changes your cholesterol, and diabetes. Past year, my cholesterol number started going up for the first time in my life, and I wasn't very happy about it, and I know that I have risk factors for my family history. And you know, the weight had started to pile on a little bit, so I lost 10 pounds and my bad cholesterol dropped 40 points. So I was so happy, because I really didn't want to go on medication. But it really showed me something too. And it's always, you know, now I'm working on keeping it off, which is a whole new set of challenges, but we all have to do it. All right. People want to exercise to lose weight, and people want to take a little walk like this for 10 minutes, and then they eat a candy bar because they put out all that effort. If you want to use exercise to lose weight, the 30 minutes is great for your heart, it's wonderful. But to really use exercise to lose weight, you're talking 60 to 90 minutes a day. That's a lot of exercise. So that's why you really need to increase your movement. That's not realistic for most people. Most days, I would love to exercise that much. I really enjoy it. But my day isn't going to allow me to take an hour and a half every day to exercise. So a little bit of exercise and a little bit of cutting calories will give you an easier balance to work with. So there's easy things that you can do if you really, again, start thinking of solutions instead of the problem. There are things you can do. I think a pedometer is a great way to get started. Put one on and you just be amazed at how much or how little you actually walk, and just try to increase it a little bit. We have, I don't know if you know the parking at Milford Hospital. I go way, way over. I never have to fight for a parking spot. And I figured out that it actually adds a quarter of a mile. It takes me 10 minutes to walk in, and then when I leave again. So it feels like a free, you know, quarter of a mile that I've put on my schedule without adding any extra time, really. So small things, if you think of small things. When eating out, if you share an entree, save half for the next day. But honestly, portions have gotten so big in restaurants that sometimes you should eat a quarter of what you're given. And then you feel deprived. You feel like, you know, who doesn't want to eat that beautiful plate of food in front of you? So eating out less often is really a good management program too. So you want to walk to a coworker's desk, use the stairs when you can. Just start looking for opportunities. So the metabolic syndrome that we talked about, there's certain risk factors that go together. You're overweight, especially when you're that apple and not the pear. I'm a pear. The weight goes here on the hips. The apples, are here, okay? And that type of fat deposit makes you more likely to have a problem. It goes along. Now, if you have 3 out of 5 of these, if you have the high blood pressure, cholesterol, either low HDL or high triglycerides, and elevated blood glucose, whether it's diabetes level or the pre-diabetes that we talked about. So you need to be treated very, very aggressively. And again, it's diet and exercise, moving more, eating right. So you can see how if you start putting risk factors together, if you have no risk factors, it doesn't mean you'll never have a problem with your heart. You may, but you haven't volunteered to go early. Smoking really raises your risk, smoking and cholesterol, and then smoking, cholesterol, and hypertension. You can see how your risks just keep going up. I think if you exercise is absolute key. If you only did a couple of things, I would quit smoking, and then I would exercise, because it touches on so many of the things we talked about. Your blood pressure will go down. You can prevent diabetes by exercising. It'll lower your LDL and the bad cholesterol, and it raises the good cholesterol. It will help you to manage your weight. It's not a magic bullet, but it will help. It really helps you to manage stress. And who isn't stressed nowadays? They've done studies, a 30-minute walk 5 times a week at a moderate intensity, like just a brisk walk, you don't have to be running or jogging, is equivalent to taking an antidepressant pill with no side effects. So I think that's, you deserve it. You're worth it. And it's good for your bone health, too. Another subject for women. So when I first started cardiac rehab, we were all going to go on estrogen the minute we went into menopause, because it was the magic bullet. It was going to save everybody. But the tests have just shown it absolutely does not prevent heart disease. In fact, women can even be at higher risk the first year after menopause when they start taking it. So it can increase strokes, and we really need to work on the things that we know do work. And hormone therapy could still be used for some of the menopause symptoms, but you really need to do a careful analysis with your doctor at your risks to decide whether that's worth it or not. But it's not an automatic go-to anymore. So, having a heart attack. About 40% of men and women will feel an uncomfortable pressure, tightness, heaviness, squeezing, fullness, usually right here in the chest. That's about 40%. You hear a lot about women have different signs of heart disease, and they can, but the majority is going to be feeling that pressure. And oftentimes, as a medical person, we'll say, do you have chest pain? We always use the word pain, meaning all these things. And people say, I never had pain, but they had the tightness, squeezing. Something's wrong. You might have pain in your neck, your arms, or your back. When my father had a heart attack, he had a pain in his left elbow. And he would worked in the garden all weekend and thought, that's all it was. And a few hours later, collapsed at his desk. So fortunately, got good care and made it. But unusual shortness of breath. Now, if somebody climbs up 2 flights of stairs, I'm a little short of breath when I do the 2 flights of stairs, especially if I'm hurrying. But if you're doing your usual activities that you used to do just fine, and all of a sudden you're just not able to breathe as well, that's a change, okay? And that's what you need to look at. Women and men with diabetes, oftentimes shortness of breath might be their only symptom. They might never have any pain. It changes the nerves in your body to give you different symptoms. Nausea, vomiting, dizziness, sweating, and unusual fatigue. Who isn't tired, right? But this is a profound fatigue where you look at the stairs and it looks like you need to climb Mount Everest. A really unusual and prolonged fatigue is an important symptom for women. And oftentimes we put it, I'm just a little depressed, or something, I should quit smoking, or I'm not getting enough exercise, I need to lose that 10 pounds. If you've got an unusual amount of fatigue, you really need to get checked out for it. And a feeling of doom, a sensation that something's wrong, you really need to listen to your gut. We've got pretty good intuition. You know your body. Don't ignore those signs. If you feel like something's wrong, be persistent and get it checked out.
I've got a question about the nausea.
Mm-hmm.
The question about the nausea is:
Yes.
Is it something that remains constant, like a sign of it? Would it be a constant nausea, constant dizziness, all those symptoms all at once, continually happening, or happening on and off?
I would say that it could be either of those, but it could wax and wane. It might come and go and be, oh, it feels a little better. You took some Tums, it feels a little better, but it keeps coming back on you. Okay, or it could just stay it could just stay that way, and you could start breaking out in a cold sweat. Usually, it's very hard to describe, but usually you will know. You really have to trust yourself that you will know when something is different. Okay, so it could come and go, or it could be steady. But what it isn't is usually, I mean, I can't make any firm rules, but you know, everybody feels maybe a little twinge in their chest that goes away like that. That's usually not important, okay? And people, after they've had a heart attack, they are so aware of every single twinge in their chest that they're constantly wondering, is this it? Is this it? And one of my patients once told me, tell them, they'll know. He says, I don't know how to tell you, but you will know. So
part of that question is, if I'm waking up every morning extremely nauseous and I go and I have something to eat, should I be concerned?
I think you should be concerned enough if you're waking up every morning like that. It may have other reasons, but yeah, I think you should be checking it out. I do. Okay.
Thanks.
Very seldom as dramatic as the old movies when this is the big one and they, you know, you get the elephant on the chest. It can be that bad, but it's often not. So, but the most important thing is to get help immediately. It's when I started here, and I started my career in Milford Hospital in 1985 in the ICU, people would come in with a heart attack and we would just sort of take care of them, make them comfortable, and then we had to wait and see what would happen. You know, how much damage was going to be up to that person's body and what went on. Now you'll come into the ER, you'll never even make the ICU. They will ship you out either by helicopter or ambulance, and in 15 minutes can have you in a cath lab, opening up that artery, getting blood to the heart, so that we can have many, many people with technical heart attacks with no damage to their heart. So it's amazing, but the time is muscle. And the more muscle you lose, the more it's going to change your life when you recover. Yes. I think Deb wants to use the microphone for the...
I hear about taking the aspirin right away when you feel like you... Is that true?
A chewable aspirin or chewing an aspirin, it's important to chew it. And I'm not sure what the doctor... I think that's an important thing to ask your own doctor, okay? I think that's a very important question, but it's fairly new. If I had a family member that was having chest pain and I thought they were having a heart attack, yes, I would give them a chewable aspirin. I would make sure that they chewed. It doesn't have to be chewable, but other kind of aspirin tastes pretty horrible. It's not important. Why chew it? Because it breaks it down so that it's instantly getting into your bloodstream and begins to break up the clot and help to prevent the heart attack.
And what about people that take aspirin every day as a preventative?
I know that's been a big question because all of my patients take an aspirin every day. And again, it's important to discuss this with your own doctor. I think a lot of the doctors have said they want them to take it anyway. But you know, aspirin is not without its risk for bleeding and stuff. That's why I'm not going to stand up here and tell you that I don't know anything about you to take the aspirin. But if you really think you're having the signs of a heart attack, yeah, I think that I probably would do it myself, yes. So 911, and don't ask them to take 10 minutes instead of 2. Having a stroke, I actually had one person have a stroke at cardiac rehab right in front of my eyes, and I will never forget it as long as I live. Everything was fine and dandy, and then he was sitting down in a chair, and I looked over, and his face was drooping, his arm was hanging by the side, and he was gazing off into space. I said, "Are you okay? Are you okay?" He couldn't really answer. We had him, I'll tell you, he got quick care. He was down in that ER in 2 minutes. But sudden numbness or weakness, usually on one side of your body, confusion, trouble speaking, trouble seeing maybe in one eye, trouble walking, or sudden severe headache with no known cause. You know, you whack your head on there, you've got a headache and you know why. But all of a sudden you have a really horrible headache for absolutely no reason. You have to think stroke. It's a brain attack. And again, it's so important that you get help very quickly because they can sometimes interrupt that and prevent the stroke. And it's usually not going to be the person who's having the stroke themselves who's going to recognize this and make the call. So it's a good thing for you to know, but it's a good thing for your family members to know too. So what do I want you to take away? I want you to know the symptoms of heart attack and stroke, know what your risk factors are for disease, work with your nurse or your doctor to reduce your risk. So again, quit smoking, get the blood pressure, cholesterol, get those under control, and manage your risk with healthy behaviors. You have a lot of control over how healthy you are by the simple decisions you make every day about how much you're going to move and what you're going to eat or not eat. So I'd really like you to spread the word. Again, the handouts that I had were the living guidelines for women. It gives the numbers that we talked about, and some great resources from the internet. So I hope that you will get those, and thanks. I think we have about 3 minutes for questions, if anybody. Yes?
Periodically, I get these things in the mail, and they're solicitations to go have arteries checked at some location for a minimal fee, $100 or so. Are these? I've never done it, but are these types of tests? Do they really tell anything, or is it just some kind of a medical scam? What is this all about?
I think it's a combination. I think that somebody's making money off of it, and people are shelling out the money, you know, cheerfully, hoping to get some reassurance. But I think if you have a doctor and you go to and talk about these tests and what tests are needed for you, that I think that's the better route to go, because you want someone, okay, you find this out, now you need some follow-up. I think that you can get what you need from your regular doctor. So I don't think you need to pay $149 out of pocket for those tests.
I guess what I'm asking is, you know, someone that doesn't have symptoms, and if do these tests actually show what they?
Yeah, I think the tests are legitimate.
Indicate.
I think the tests are legitimate, but
Okay.
they're a little bit of taking things out of context and becoming our own doctors. And I've tried that before, and it didn't always work out. It really helps me I always want to be involved in my medical care, but it really helps to have this person who went to medical school and has a much broader picture than I do to work with him. So that would be my recommendation. But the tests themselves are not scams, no. Okay.
And one other thing I'd heard, that if you feel like you're having a heart attack, and someone mentioned about the aspirin, and I don't know if this is true, but I was told to try to cough, violently try to cough, to get your heart to jumpstart, so to speak. Have you ever heard that?
I have heard it, and I've also checked into it, and it's some people say, instead of, you know, like when we use a defibrillator, I don't think you can cough yourself out of a cardiac arrest. We have a lot of laughs about it, but I really think 911, not a cough.
My job requires that I walk like 2-3 hours a day.
Great.
Anyway, I did have a heart attack back in November. I'm just curious, do I need to add an additional, to benefit my heart, should I add additionally to that 2 or 3 hours because my body's used to it? Or is that enough? Should I increase it because I'm used to that amount of exercise?
Well, there's two things I would ask you. One is your activity steady enough? Because lots of people have physical jobs, but it's stop and start, you know?
Stop and start.
So you're not having that continual time when you're putting your heart, you're demanding something of your heart and making it say, oh, she's serious, I better grow some new little collateral circulation. The other thing, did you have that job before you had the heart attack?
Yes.
Then I would suggest it didn't, you know, people tell me, well, I golf, that's exercise. It's like, well, you were golfing when you had your heart attack, and that didn't stop that one. So I would recommend that you tried to get that steady state of exercise in. Yep, well, just 2 more questions, all right, because I don't want to cut into everybody else's time. Yes?
I was actually having heart palpitations, and I called the NurseWise program and, you know, went through the whole list, and everything was fine. And a friend told me cough. So I had heard that, and that's for heart palpitations, and
Okay.
it has worked.
Good,
It
good.
interrupted it enough so that it passed without having it for the 20 minutes the next
Okay.
time it happened. But my question is, I've had jaw pain, so I've actually been seeing the doctor, and I'm working at low my cholesterol, all that. But online I read that there are tests that they can take to see if you actually had a heart attack. Because I didn't call 911 or anything, you know, you tend to think, oh, it's going to go, by the time they get here, it'll be done. And it did. I mean, it was less like 10 minutes.
Okay.
So I asked my doctor, you know, can we find out what really happened to me?
Mhm.
And they said, if you think you're having a heart attack, call 911. Well, is there a
Well,
test?
if you had a heart attack, it's possible that EKG would show changes.
I've been flying. I was running on the treadmill, and they said, you can, you know, we're all done. When you want to stop, you
So
can.
you've had a stress
I've
test
had it
and there's
all.
nothing
The
showing.
EKG, everything.
Yeah, and jaw pain can have other causes, but I would still kind of keep it in the back of my head and not be afraid if it happens again to, you
So
know.
there is no actual, like, I thought it was a blood test or something.
There's a blood test that can tell you while you're having the heart attack.
While,
But it's while you're having the heart attack or shortly afterwards, but after a week or so, no. No, there's not. So, well, thank you all
Thank
very
you.
much.
Thank you, Kathy.